We have already covered the high risk and the intermediate risks for antenatal thromboprophylaxis with LMWH. Okay. Now, what is the importance of these two risk assessments is those patients which fall into the high risk category, we have to involve them to specialists or trust nominated thrombosis team, those which are in the red zone, that is those patients who have a history of VTE except a single episode post surgery. Now both these two sections, the red and the orange, that is the high and the intermediate risk zone, they require antenatal prophylaxis. That means right from the time of diagnosis of the risk factor, they have to be given LMWH for sure. But now when we are coming to this blue category, now this category is interesting because here we have to start counting. Okay. Over here, if we have 4 risk factors from this chart, it will go to the upper category. It will also require thromboprophylaxis from the time of diagnosis. So 4 is a huge number. Okay. So when 4 is the score, then it becomes just like the orange and the red zone. But if the number of score of these risk factors, which we will just remember now with a mnemonic, but I'm just trying to impress upon that if the score is 3, then antenatal prophylaxis is to be given from 28 weeks onwards. Okay, so 28 weeks onwards. And if it is less than 3, that is if it is 2, for 2 we have to assess the patient. Okay, suppose if she has 2, normally which she has some risk factors, which is not 3, less than 3, but these factors are there. For those patients, we will tell them, please mobilize, don't get dehydrated, because we know that prolonged immobilization or dehydration will put her into a score. So we will always tell her that don't get dehydrated, be mobilized, and in case she is admitted, we will give her thromboprophylaxis for a score of 2 and less. For 3, we have to give it from 28 weeks of pregnancy, and 4 and above, and the orange and the red, we have to give thromboprophylaxis from the time of diagnosis. Is it? Okay, so this is very basic that we have to remember. Now, so we will talk about this chart, okay, where the scoring numbering starts. Okay, now this is about this lady. Okay, now if you can see this test tube signifies a test tube baby. That means it is an IVF or ART pregnancy. Okay, so this is a score. Now, if you give a closer look, you can see today is this lady's 36th birthday. Okay, so she's become 36 years old. That means the age has to be less than more than 35. Okay, 36. So age more than 35 is again given a score. Now, if you can see very closely, she looks pretty fat, man. I mean, the legs are fat, the tummy is fat, and she's also kept a weighing machine. And you know, her BMI is more than 30. 36 years old with a BMI more than 30. Okay, more than 30. This more than is very important. Okay, that means BMI of 31 we can say, 30 point something has to be. So you can remember as 31. Okay, so she is obese. She is aged. 31 weight, BMI 36 years old. This is an easy way to remember it. Okay. Now you can see, oh my god, she is also a smoker. This again makes it difficult for her. You can see that she has got two babies, one, two. That means multiple gestation. Multiple gestation is again a risk factor for venous thromboembolism. Now, if you can see, she's got red head. She's got headache. The BP machine is showing it is there. That means she's got headache with BP monitoring. There is high BP with headache. That means she has preeclampsia. Okay. You can also say if she's vomiting. So she is preeclampsia. Okay. Preeclampsia. This is suppose one. Here you can say it is somewhere near 140 by 100. So basically she has preeclampsia in this pregnancy. Okay. Now if we go down, we see this lady is very lazy. See, she has become aged. Now she's got two babies. She is fat, so she doesn't want to move. Okay. That means she has a situation, what we can say is immobilization. Okay. She just doesn't want to move. So she's lying down here for the last 3 days. Oh my god. So Monday, Tuesday, Wednesday, or WTF, Wednesday, Thursday, Friday. 3 days she has not moved. Okay, I think WTF is the easier way to remember. I'm so sorry. So 3 days she is immobilized. She's fat. She is old. She's got two babies. She doesn't want to move. Now that, if you can see, has caused a problem in the vein. Now this is not thromboembolism, okay, because we know thromboembolism was in the high risk zone. This is gross varicose veins, okay. So when we're talking about this block, this prominent veins, and we've not shown it at a swollen leg, we've shown it as prominent veins. So if you can closely observe, the veins are gross varicose veins, okay. Now there are three little cute children, 1, 2, 3. So her parity is 3. She's got 3 children already. So 3 parity is again a risk factor for venous thromboembolism. So that is one more point. Now we can see she has her family members. Okay, these are her father and mother. Suppose father and mother, we all know they are first degree relatives. Now, first degree relatives they have come to tell, oh my god, we have a history of VTE, and that too unprovoked. They have come from UP, Uttar Pradesh. Okay, family has come from Uttar Pradesh. That means unprovoked, or we can also say estrogen provoked. Estrogen provoked VTE is also considered to be unprovoked. So this family, they have first degree relatives, they have come from UP, unprovoked, and they have a history of venous thromboembolism. Okay. And last but not the least, we will go close to these kids. Now kids are very fond of having chocolates. So now you can see the 5-star is lying down here, but it doesn't look similar, isn't it? There are two different packets of 5-star. So this is a heterozygous factor 5 laden mutation. Heterozygous. See, two kids, different kind of wrappers. There were actually 3 kids. So basically, different kinds of wrappers, all heterozygous 5-stars. So that means heterozygous factor 5 laden mutation, which is a low risk thrombophilia. Now we can also see again these children, they are very pro. See, they're throwing things into the bin, very pro. They're sitting there and they are throwing it here. That means they are so pro in throwing things into the bin. So prothrombin gene mutation. Okay. So asymptomatic low-risk thrombophilias, which includes heterozygous factor V leading mutation and prothrombin gene mutation. These are, so these low-risk thrombophilias, along with all of this, is it comes into the blue box. Okay, so this covers all the points of the blue box. What we have to remember in this blue box is 432. 4 pushes it up antenatal. So basically, we have everything in this blue box. If the score is 4, they are given antenatal prophylaxis from diagnosis. If the score is 3, it is given from 28 weeks onwards, and if the score is 2 or below, then we will give them mobilization, avoid dehydration. But in case there is admission, then we have to give the patient thromboprophylaxis. So admission with a risk factor again makes the patient eligible for thromboprophylaxis during admission. Okay, so this is all that we have to remember from the antenatal assessment.